speak about immunodeficiencies, B cell disorders. We have X-linked proton gamma globulinemia. We have selective immunoglobulin A deficiency, and we have common variable immunodeficiency. So we will speak about X-linked proton gamma globulinemia. So it's X-linked. So more in boys. It's X-linked recessive. So more in boys. Then proton B. So BTK, B, no B cells, and B, boys, a gamma globulinemia, so there is no B cell, so X-linked, so more in boys, B, proton, B, defect in BTK, which is a tyrosine kinase gene, so a gamma globulinemia, so no B cells, no B cell maturation, plus it's X-linked recessive, so it's more in boys. So the presentation will be recurrent bacterial enteroviral infection after 6 months. Why 6 months? Because immunoglobulin G is the only immunoglobulin that passes the placenta. So after 6 months there is decrease in amount of immunoglobulin G, maternal immunoglobulin G in the baby, leading to recurrent bacterial enteroviral infection. So here there is what? Absence of B cells. So X-linked boys, BTK, B cells, no B cells, boys, a gamma globulinemia, so there is no B cell, so absent B cells, so normally the B cells will give what? Plasma cell will give what? Immunoglobulin. So if there is no B cells, no plasma cells, no immunoglobulins, so there is no B cells, no plasma cells, no immunoglobulin, so decrease in immunoglobulins in all classes. So there is what? Absent scanty lymph nodes and tonsils. Why? Because there is what? Primary follicle and secondary follicle. Secondary follicle contains what? Germinal center. So there is no primary follicle, no secondary follicle because of absence B cells, leading to absent lymph node and tonsils, so no primary follicle, no secondary follicle, because they are the sites for what? For B cell, because of absence of B cells, leading to absence of plasma cells, absence of immunoglobulins, leading to decrease all classes of immunoglobulin, plus there is no a primary follicle, germinal center, so they are absent, leading to what? Leading to absent lymph nodes and tonsils. So of course you will not give live vaccines contraindicated, so you should give what? Inactivated, killed inactivated vaccine. So don't give live vaccines. And the second one, it's called what? Selective for what? For immunoglobulin A. So selective immunoglobulin A deficiency, so the cause unknown, most common primary immunodeficiency, so selective immunoglobulin A deficiency. So A asymptomatic, A airway and GI infection, so infection in airway and GI. Why? Because immunoglobulin A covers mucosal surfaces, so airway and GI will be susceptible for infections because of immunoglobulin A deficiency. Then A autoimmune disease, A atopy. Then this is the most important one, anaphylaxis to what? Immunoglobulin A in blood products. So why? Because if you give a patient who doesn't have immunoglobulin A in his blood, you give him blood contains immunoglobulin A, so there is what? Anaphylaxis to it. So you must remove immunoglobulin A from blood products before transfusion for patients who suffering from immunoglobulin A deficiency, to avoid anaphylaxis. So here it's called what? Selective for what? For immunoglobulin A. So immunoglobulin A is the only one that will decrease, but normal immunoglobulin G, normal immunoglobulin M, normal others, but the only one is immunoglobulin A because it's a selective immunoglobulin A deficiency, so decrease in only immunoglobulin A. So this will lead to increase the susceptibility of infections in what? GI tract and airway. GI tract and airway, because this is the mucosal surfaces that's covered with what? Immunoglobulin A. So if there is no immunoglobulin A, the mucosal surfaces for airway and GI tract will be susceptible for infections. So increase susceptibility for giardiasis. So it can cause false negative celiac disease. Celiac disease needs what? Celiac disease test. So false negative celiac disease test. Celiac disease needs what? Gluten-free diet. So it can cause false negative celiac disease test. Then here we have common variable immunodeficiencies. What's meant by common variable immunodeficiencies? Defect in what? In differentiation. I didn't speak about B cell. I say B cell differentiation. It's not B cell normal. But there is abnormality in differentiation. So what is the difference between common variable immunodeficiency and X-linked proton gamma globulinemia? X-linked proton gamma globulinemia. So there is no B cells. B cell give what? Plasma cell give what? Immunoglobulin. So B cell into plasma cell into what? Immunoglobulins. So here in X-linked proton gamma globulinemia, absence of the source, absent B cells. So absence for plasma cells, so absence for immunoglobulin. But here in common variable immunodeficiency, the B cell will give what? Plasma cell differentiation into plasma cells, then plasma cell will give immunoglobulin. But here B cell normal count, but the defect in what? In differentiation. So there is decreased plasma cell, decreased immunoglobulin. No plasma cell, no immunoglobulin. Here in X-linked proton gamma globulinemia, no B cells, no plasma cells, no immunoglobulin. But here in common variable immunodeficiency, normal count for B cells, but there is no plasma cell, no immunoglobulin. So the abnormality in differentiation of B cells into what? Into plasma cell to give immunoglobulin. So no plasma cell, no immunoglobulin, normal count for B cells. So the defect in differentiation, it's not in B cell. B cell normal count, but the differentiation, so there is no decrease in plasma cells, decrease in immunoglobulin. Plus it may present in childhood, but usually diagnosed after puberty. Increased risk of autoimmune disease, bronchiectasis, lymphoma, cyanopulmonary infection. So cyanopulmonary infection, increased risk of autoimmune disease, bronchiectasis, lymphoma, cyanopulmonary infection. But the most important to know the difference between X-linked proton gamma globulinemia and common variable immunodeficiency. X-linked proton gamma globulinemia, no B cell, no plasma cell, no immunoglobulin. But here common variable immunodeficiency, normal count for B cell, but there is no decrease in plasma cell, decrease in immunoglobulin. So the abnormality in differentiation of B cell, but the B cell count is normal.